Cast is now starting. All attendees are in listen-only mode.
Good morning. Thanks for joining us today for our How to Manage Secondary Stress and Apply Trauma Stewardship to Thrive in Your Day webinar. My name is Carmen Boone. I'm an education coordinator from Oregon Pacific Area Health Education Center, a hosted agency of Samaritan Lebanon Community Hospital. And today I'll be your host and moderator. Let's go over some housekeeping items first. On your GoToWebinar control panel, you will notice that all microphones are muted. They'll remain muted during this session. If you're experiencing audio difficulties, make sure your computer speaker volume is up, and you can try using the phone option to listen in. We will email you the slides by email request. If you have trouble downloading them from the handouts option, it's in your control panel. Now going to the questions. If you have any question, you can use the questions option for typing them or any comments at any time. We will answer questions at the end, and if we run out of time, we would still answer your question via email. This webinar is being recorded and it will be posted within a week on the website that you see on the screen. If you have any questions, please feel free to email me at the email that shows up on your screen. To obtain CME or C credit for this activity, you must log into www.eats.com and enter this activity code. The activity code only is valid for 1 week, so make sure you obtain your certificate within a week. This presentation is jointly provided by Samaritan Health Services, Oregon AHEC, Oregon Health and Science University, and Oregon Pacific AHEC. And the presenters and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. This webinar is presented by Tina Runyan. She's a professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School. She, for over 20 years, has been practicing, teaching, and training behavioral health providers and physicians in models of interprofessional and collaborative primary care. Dr. Runyan is a nationally recognized leader in collaborative care, which focuses on bringing accessible mental health care into medical settings, especially for underserved communities. Dr. Fleishman, Joan Fleishman, will be joining us today, and she completed her graduate training at Pacific University School of Professional Graduate Psychology and completed a fellowship in primary care psychology at University of Massachusetts Medical School. She is the co-founder of Tent Health and specializes in providing low-barrier mental health care to healthcare providers in Oregon and Washington. She was a former behavioral health clinician director for OHSU's Department of Family Medicine from 2014 to 2020, leading behavioral health services, primary care-based medication-assisted treatment for opioid use disorder, and trauma-informed care implementation. And now, without further ado, I will leave you with Tina and Joan, and let's start the webinar.
Thank you so much, Carmen. I'm going to work here to get my screen and slides up. It looks like that is working and everybody can see the slides. Great. So good morning, I'm Tina, and I'm delighted to be here with all of you this morning to talk about a little bit of a heavy topic, but hopefully we'll move into some strategies that resource you and give you some tools in your toolkit for managing secondary stress and applying trauma stewardship in your day. So really intentionally trying to bring forth some ideas that aren't about how do you manage all the stress in your day-to-day work by leaving work, having a vacation, going somewhere warm in the middle of winter, but how do you have these kind of micro practices, if you will, strategies for how to manage this during your day. That's my hope. And so I'm joined here with my co-founder of Tend Health, Joan Fleishman. Joan, do you just want to say a quick hello so we can hear your voice, and she'll circle back in towards the end of the presentation.
Yeah, I just wanted to say welcome to all of you who have joined us, and we're really excited for this series. We've put together several topics that we think will be helpful and supportive over these next few months, and really want this to be an interactive series. So we have our presentations, which share a lot of information and hopefully are going to provide some food for thought and strategies and opportunities for reflection and real things that you can bring into your day-to-day practice. But also we have our practice labs, which are really around, okay, how does all this information fit into my day, my work, and getting a sense of actually being able to practice it with peers and colleagues and with us there as coaches to kind of talk about how to, some of these things are yet simple, but yet so hard to either remember to do throughout your day or throughout your practice, or are hard to implement in a busy clinic schedule. So we want to, hopefully what we're presenting in this series are real actionable kind of information and strategies, but really want this to be a very collaborative and accessible and interactive series, and particularly the practice lab. So welcome. It's early in the morning. Thank you for getting up and joining us, and we're excited to be here, and I'll see you at the end.
Thanks, Joan. So hopefully you've gotten information about this series. It's just reflected here, and this is a slide that's in your handouts as well, to just give you the topics and the dates. And really excited to explore this idea of practice labs and much more kind of Zoom, live online, interactive, not didactic, slide-based work with you all. So as Carmen mentioned, we don't have any conflict of interest. Just a disclosure that at Tend Health, we do provide mental health and well-being services to individuals and organizations, and we are quite passionate about the prevention, identification, and treatment of mental health concerns, specifically with health professionals, although we are not here to sell anything today other than promote some ideas and food for thought. Before I launch into what we are planning to cover, what I hope to talk about, I also just want to recognize for those of you who are joining today, regardless of what your role has been throughout the last 10 plus months of this pandemic, just a deep bow of gratitude for showing up as you have been, and whether you have shown up with excitement and feel like, you know, you've been training your whole life to do this and work in healthcare in a pandemic, or whether you've showed up very reluctantly and scared and fearful and anxious, and anywhere in between, and probably different emotions and different sentiments on different days, which I would expect. So regardless of how you showed up, just a deep bow of gratitude to all of you who are showing up. And all of our lives are, you know, sort of forever altered through this experience, and some more than others. And I think you all count among that specific group. So thank you. Today we're going to talk about secondary stress and common effects of secondary stress. And then I'm going to introduce something that we don't often talk about in terms of a stress response, and that's something that is called the tend and befriend part of our stress response that is actually physiologically intrinsic to the human stress response, but it has been given much less fanfare, much less attention compared to what we would normally think of as the fight or flight part of our stress response. And learning about what is the physiology of that, and more importantly, how can we activate that tend and befriend response in the face of secondary stress that's brought in because of the work that we do. The work that we do is incredibly meaningful, and for most of us, we feel a deep privilege to be able to do this work and to be with people in such intimate and substantial ways as part of their healthcare journey and sometimes part of their illness and disease journey. But it affects us, and so how do we, with those occupational exposures, how do we leverage this tend and befriend response? So that's where we're going today. Before I can really get into the stress response and do a quick reminder about the stress response, it's important for me to underscore that stress as an experience is not a bad thing. In fact, there's parts of it that are actually quite good and helpful for us as humans. So anything that stresses us cognitively, stresses us emotionally, stresses us physically, is creating some change in our physiology to be able to meet that stress. And there's a part of that that's actually quite good, because with the right dose amount of stress, we actually are energized, we're focused, we can get into what's sometimes referred to as that flow state, and our performance and our concentration and oftentimes our enjoyment is really at its peak. When we don't have any stress, we actually can become quite disengaged, lethargic, uninterested, bored even. When we usually colloquially use the term stress, we're talking about it at that further end of the continuum. However, when stress actually is too intense or has been going on for too long a period of time, is too unpredictable perhaps. So that's the kind of stress that we often refer to when we say, I'm stressed, or this was stressful. And just to remember that they're actually, in its entirety, that stress falls along a continuum, and that some degree of stress is actually quite helpful for us. And our charge is really to be vigilant and to be conscious of when it's slipping over to the other side of that bell curve, and instead of it being supportive and engaging for us, it's actually beginning to break down on any one of those levels, kind of cognitively, emotionally, physically. So just a little levity to get us started. So, you know, many of us are in a role where we are confronting suffering. And that people are scared about what's going on in their health, and not maybe every single encounter of your day, depending on your specialty, depending on your environment where you work. But for a lot of us, right, this is what we are faced with kind of repeatedly throughout the day, is seeing somebody suffering. And then most of us don't really have the luxury of like, oh, okay, let me go help myself, right? Let me go help myself. We don't know how to do that as much, and we don't often have the time or the resources to do that. So when I talk about these concepts, I just want to draw a little bit, parse a little bit these terms, because we hear them a lot in this circle around what's going on with the healthcare workforce. And they're related, but also there are some nuances and there are some differences. So I want to be clear about what we're talking about today. So many of you have probably heard the term burnout, and burnout is a condition that was not first coined related to health professionals, but it is often assessed, and many health professionals really identify with this concept of burnout that has three core components: a sense of emotional exhaustion, a sense of cynicism and kind of feeling sort of withdrawn, cold, detached, and then a third component of decreased sense of personal accomplishment. And to be burned out, you don't actually need to have all three of those. You can be burned out with any one of those three components. So that's the sort of end result, if you will. Burnout is talking about an experience in people as an end result. Secondary stress is can be acute or it can be chronic, and that is a response that our stress response is getting activated in our work settings. That's what I mean when I refer to secondary stress, that your stress response is actually going off on a fairly regular basis because of the nature of your work. Vicarious trauma is also a further downstream effect where if the nature of your work involves repeated exposures to people who experience a lot of trauma. So if a lot of your work as a healthcare professional is doing asylum evals, for example, or you're working as a pediatrician related to with child protective services, or you're working consistently in a trauma setting, there are certain kinds of work and repeated exposures where we can experience vicarious trauma repeatedly, which begins to change our worldview, our perception of ourselves and our perception of others. And we get pretty keen on seeing the downside or the potential downside. So instead of seeing, right, a group of kids sort of on their bicycles enjoying the first of the spring days, our mind goes to, oh, there's a head injury coming down the street. That is an indication of what can happen with vicarious trauma. You may also be familiar with the term second victim syndrome. That's really referring to instances for people in healthcare settings where there is a medical error with or without a bad outcome, and the consequences to the healthcare provider as a human being, as an imperfect human being who is bound to make a mistake at some point. And the corresponding or the sequelae that comes from that in terms of guilt and shame and often silence and suffering in silence that happens. And so that is more of a related to an acute event or accumulation of acute events, if you will, of secondary victim, where there's some immediate sequelae happening because of an event. And then you may also be familiar with the term compassion fatigue, which some will say is sort of can be a misnomer, that there's no such thing as kind of being fatigued in terms of compassion, partly because of the neurocircuitry of compassion is one of, in some ways, kind of a very deep and never-ending well, and that compassion is always on offer, and it's always energizing, and it's always pleasant. But I think what this refers to often is that sense as a caregiver of I just don't have it in me. It's very similar to aspects of burnout in that way, where instead of a request or a need feeling like an opportunity to serve, it feels like one more thing, and that it feels like a burden rather than an opportunity. And so some of you may be identifying with one or more of these experiences, but I just want to be clear that there are nuance, there are some differences, and we're really going to be focusing right here in terms of secondary stress and the common responses to secondary stress, who's susceptible, certainly anybody who is providing care to people who have a lot of trauma or distress or even just suffering. And then the risk factors related to that certainly involve people's personal histories of trauma. And this is an interesting one because oftentimes, it's not unusual for healthcare providers to have something in their story that led them to use their talents and intelligence and work ethic to go into a helping profession. When there's so many other things on offer, to turn towards a helping profession, oftentimes it may not be trauma specifically, it may be something within the family or somebody in the family having an illness, but oftentimes there's some story there that leads us to that particular work. And while that can be really motivating and a gift, particularly around empathy, there also can be a shadow side to that and present some vulnerabilities if we're not being really sort of aware and vigilant to understand how that might be showing up for us in the face of repeated work stressors. And then certainly kind of an organization that's not particularly attuned to or supportive of the work that you're doing, inviting these repeated stresses. So if the work that you're doing is one where you have repeated exposures, or the volume of suffering that you are expected to meet and manage is overwhelming, and you don't have an organization that is recognizing that and providing opportunities for recovery, that can be a real risk factor. And I think our healthcare organizations institutionally are just now coming around to recognizing that we have humans caring for humans who have the same susceptibilities and vulnerabilities. And the pandemic has really shed light on that, because for many of us, not only have we been trying to hold things up related to our profession and showing up as a healthcare professional, many people are also having to figure out, daycare, educate their children at home, and concern about perhaps other family members or parents who might be older and trying to meet their needs while keeping them safe and protected. And so all of a sudden, you have these things that make any one of us susceptible. And then you add a global pandemic and all of the challenges that that brought, which is not depicted in this schema. And you can see that while there may have been a point in your career where you were handling all of this fine, like, why now? It's so hard now. Or it may be that it was hard for you early on and you actually feel like you've worked out some strategies to meet all of that suffering and stress, that it can show up at different points along our career trajectory. But these are the things that actually create some of those vulnerabilities and potential for us to really begin to feel the downstream effects of secondary stress. So like I said, so there's personal responsibilities, but there's a lot around kind of our working conditions and our systems that can either support and resource us, or can continue to place an undue burden so that there's no opportunity for recovery in the face of secondary stress. And I can say this because the stress response is an innate human experience, and thank goodness that it is, because it doesn't require any one of us to have this real-time calculus around, should I activate my stress response or should I not? The stress response is a universal human experience anytime your nervous system perceives threat. And when it does, there is a cascade of things that happen that you can see on this slide that happens for every single one of us. And it results in our body getting very quickly prepared to address this stressor, to fight or to flight. And we don't have to think about it. It just happens automatically in our body. And again, it's exquisitely designed. Thank goodness that it does. But when you are in an occupation where you are repeatedly hearing stories or having exposures that are activating that stress response, there is no other way to say it other than your stress response is going off too often, perhaps too intensely, and perhaps for too long of a period of time. And any of us that are facing that will have some downstream consequences to that. There will be some allostatic load on the body, if you will, when that is happening. Again, if we're not really trying to do some things kind of organizationally to help and support and protect people, and internally within our own, or within our own system, if you will, to do that. So most of us can experience acute stress, in a moment and recover, and that's fine. But again, I'm talking about when you have these repeated exposures in your work setting. And what happens is you have that strain and stress, and that actually can be okay to, again, maximize that performance, thinking back to that curve. And it can be okay if you have time to recover. If you have some opportunity to experience the stress response and to recover, your body actually gets stronger. There's a stress hardiness there. That's a building of resilience. When you have chronic unremitting stress, however, and if it's coming from work, from home, from multiple places, from fear of this pandemic, you begin to get an allostatic load that it's like the train left the station. Because for most of us, once we have that kind of chronic unremitting stress, we very reflexively move towards things that help us feel better in the short term, and we move away from things that might actually facilitate our recovery and our coping. So we are much more likely to begin to engage in some behaviors that actually have some additional health risks, put some additional strain and stress on our body. Things like overeating or making different choices in our dietary habits, perhaps even in our hydration, getting a little more sedentary, perhaps using substances, sacrificing sleep. Because in the short term, those things actually can help us feel a little better in terms of addressing the stress, but in the long term, it's creating more and more allostatic load on the system to the point where you can actually become at risk for any number of these things that are related to the chronic stress and inflammation experience. And again, this is just, I'm describing human behavior. So you may find yourself in one or more of those areas, but this is just what can happen with a chronic stress response. And so first is just being aware of it and sort of seeing, is this happening to me? Can I see myself in any of this? So here are common experiences to, again, repeated exposures to trauma or unremitting chronic stress. And that, you know, feeling any one of these in a particular instance of exposure is not a problem at all. Feeling any one of these intensely and for long periods of time, and feeling a combination of these things is where I want you to just be tuning in for yourself to see if you see yourself in that. And one, to recognize that in some ways there are some unique occupational hazards to the work that we do, and this is not a failure of you. This may just be a manifestation of how you've been trying to do your best up until this point to manage this level of stress. And when this is happening, there are common emotional mental health manifestations that we've been seeing, and you can see this in the literature related to the pandemic. You see reports, not just of healthcare professionals, but just in the general community of really a massive increase of self-reported symptoms of depression and anxiety. I don't want to go to the point of saying these are clinical diagnosable conditions, but you see significant jump ups where well over 30% of the general population is, you know, reporting, endorsing the PHQ-2, if you will, and the GAD-2. So clinical level of some symptoms of depression and anxiety. And I think underlying that really has to do with the stress response and the way we try to cope with those experiences, at least in the short term. Other common mental health manifestations of this are getting really much more rigid in your thinking when we feel that increased stress. We tend to contract, and we contract in all ways, including in how flexible we are in our thinking. Our cognitive flexibility decreases, and our frustration tolerance decreases. So you might not be somebody who you know is known around the office as being somebody that lashes out or loses your temper or is being irritable with staff or with patients or with colleagues, and you may find that happening more recently. It's not uncommon at all, because that frustration tolerance has really decreased, because most of us are running, our baseline is running so much tighter to that threshold. And so it doesn't take much to cross that threshold. Like I mentioned, any kind of substance use or really any numbing out behaviors. You can actually see this in, you know, just in my house too. I've gone through more Netflix series than ever before. I think that's really common. And on one hand, it's entertainment, it's passing the time. And on the other hand, sometimes it is pure numbing out, where things are just sort of playing in the background and you may not even be fully present for them. So any kind of numbing out behaviors in small doses, not a problem. Becoming habitual and really taking away from other things in your life can become a bigger problem. See a lot of relationship strain, and then a lot of somatic manifestations. So if you've been paying attention to the first part of the presentation, that hopefully makes a lot of sense of why you're seeing those somatic manifestations of this stress response that's going on, and anything that is related to an increased physiological stress response or inflammation, you're going to see worsening of those. And then because of this beautifully designed mind-body connection, increasing somatic symptoms often plays out on the emotional realm. Worsening emotional realm often plays out in the body. And so you may be seeing this both in your patients, certainly in your patients, but also in your cells. We don't have a lot of really solid data yet on what the impact of this pandemic is on healthcare professionals, but here's just a sample of what it was in 2019. So this is pre-pandemic, using a very brief score, a very brief measure called the Well-Being Index that is used nationally. And so pretty decent sized numbers of physicians and nurses, and you can see really fairly high level of distress being reported, over half feeling burned out, characterized by that operational definition of burnout I used earlier, and over half being bothered by emotional problems. That was before the pandemic. That was pre-pandemic. And yet, among both physicians and nurses, 85% saying that their work is meaningful. And I think this is really notable, and I want to talk about this in a minute, is that it's not that people don't want to be doing this work or don't feel like it is purpose and mission driven and that it is their calling. That seems to be fairly unprotected, even in the face of high level of distress and burnout. And so just tapping into that sense once in a while that your work is meaningful is not an adequate elixir. It's not inoculating people to experiencing these high levels of distress in their work. And so, the 2020 data is not out yet, but I can promise you it's not going to look better than this. And so we have some work to do. And all of this first part of this presentation, I think, is really best summed up by this quote from Rachel Naomi Remen, who's a internist and palliative care physician. And she says, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." And I think that's just so, such a poignant and really spot on reminder that yes, this work is meaningful. Yes, this work is a privilege. And actually, none of us, I think, want to be unaffected by it. Part of why it's so meaningful is because we are affected by it, but we often don't learn the skills to be able to meet it on a day in and day out basis and feel supported by our organization and feel resourced internally, right? And so many of us often feel like this, right? Am I making a difference? And this is where that sense of, related to burnout, the sense of decreased personal accomplishment can come in. Like it feels like I'm working so hard, working, and is it making a difference? And so if this is you, if you are feeling this way, one, know you are not alone. And two, beginning to maybe conceptualize and thinking about it as, you know, is there a chronic stress response that maybe needs attending to? The other thing I'm going to just encourage you to ask yourself, you don't necessarily need to put this in the chat or share it with anybody, but when you are suffering, what do you tend to do? What is your go-to response, if you will, when you are suffering? And we're all pretty patterned in this way. And we all have things that, whether they are long-term helpful or not, we've come to them because in the short term, they actually provide a little bit of relief. But we have to start with being honest with ourselves. What are you apt to do? My experience in working with healthcare professionals, and that's my clinical practice, has been my clinical practice exclusively for the last several years, is that there's actually an overemphasis and an overtraining on tamp it down onto the next thing. Ignore, turn away. It's, that was that sort of essentially, close that door to that exam room, go into the next one without really unpacking or processing it. And so one of the strategies, I think, is compartmentalization that many of you might be recognizing in yourself, that we tend to do that. This is just, another example of something we may tend to do, right? It's a new antidepressant. Instead of swallowing it, you throw it at anyone who appears to be having a good time. The other question I'd like you to ask yourself, though, is when you are suffering, what do you most want? And this actually may be different than what you tend to do. What do you most want? As human beings, what we most want is to be seen and to be supported, actually, to come together when there's a lot of suffering, right? And just notice, even just watching this image, what happens for you. This is exactly what most of us want when we're suffering. And it can be hard to ask for and hard to make time and space for in the middle of our day. But the most widely researched and protective factor in the face of trauma and chronic stress is social support. And that support can be provided by family, friends, supervisors. And I'm going to add another one. It actually can, in some ways, be provided by ourselves. But one of the reasons there's less overall rates of PTSD in natural disasters compared to individual trauma exposures, if you look at sort of people who have particular trauma exposures that are individual and what are the rates of PTSD in that compared to rates of PTSD from a national disaster, the rates are much different and they're much lower for people who've been through a natural disaster. Why? Because of this. When you're in something collectively and you have that social support and you have that very tactile resourcing, and you know that you're not alone, that will mitigate the trauma exposure and the sequelae of trauma better than anything else. And you probably know where I'm going with this. So it's not surprising with this pandemic and the physical distancing, which, everyone's called social distancing, which really is physical distancing, but taken to the extreme is a lot of social distancing. We've lost touch. Many of you have probably lost the art of touch in your clinical practice in some ways, or much more hesitant, much more selective in that, right? And certainly with people outside of your immediate bubble, there's probably been a decrease in leveraging social support and social support that doesn't involve touch and social support that involves touch. So when I talk about the stress response that is universal to all of us, our baseline is that we are wired for safety and we are wired for connectivity. And that's the happy place for most of us. That's where that's where we hum along in our really optimal state of arousal. We can handle a little bit of stress, if you will, that's going to help us perform, but it's all sort of staying in that sweet spot. That's what we're wired for. As soon as our nervous system, and I'm using that term very intentionally, our nervous system is what detects threat or not our prefrontal cortex, not our thinking brain. Our thinking brain can, in time, override our nervous system to say, oh, that's a car backfiring, that's not the sound of a gunshot. I can downregulate, but our nervous system is detecting sights, sounds, smells, anything tactile as a threat. And I say that also to understand that we, as who we are not responsible for when our nervous system is firing and detecting a threat or not. And this plays a lot into issues around kind of bias, actually. So this is happening at the level of our nervous system. We're not responsible for it, but when it happens, there's a cascade of things that are going to happen for every one of us. And depending on that threat, it may cycle very quickly, or it may be a little longer if there's actually a threat. So your system's going to start orienting, looking around, sort of trying to see, is this a threat or not? It can downregulate if it's not, but it's going to kind of complete this cycle of fight, flight, freeze. We don't really talk about that as much. That's a period of actually pretty high physiological arousal with low physical mobility. And then you go into a state of recovery, and this is where you get resilience. So when you stress and you have recovery, you actually can build your resilience. If you get stalled in this process, if there's no recovery and integration, if your system is going off, but you just turn away, tamp it down, compartmentalize, you're actually not circling back around to the state of a really optimal functioning and building, doing that bicep curl where you actually are building that kind of resilience to emotional stressors and suffering that you're experiencing throughout your workday. So the reason social support is so important, and this tend and befriend response, if you will, which is intrinsically part of our stress response. So you have fight, flight, freeze, but you also have tend and befriend, which is that recovery phase and can downregulate your system. Instead of being mediated by ACTH and cortisol, adrenaline, norepinephrine, and epinephrine, it's actually mediated by endogenous opioids and oxytocin. Most of you all know what oxytocin, sort of like the cuddle hormone, the bonding hormone. One of the reasons this part of the stress response was actually not promulgated as much in the 50s when Sele sort of, and Cannon came out with the stress response is because all of that early research was done in men. And you actually can see this tend and befriend response more so in females, which makes perfect sense if you think back to kind of our evolution. Females are not quite as fast or as strong, so their fight and flight options are limited, but their ability to affiliate, right, to get into bigger groups, which have some protection, and their ability to tend to and to care for the more vulnerable parts, i.e. children, in that group was very strong. That was the stress response, tend and befriend, mediated by oxytocin. And what we know is oxytocin, when it is released, it decreases those other hormones that are being activated in a stress response. So it's why something like touch, why something like a hug can downregulate our nervous system response. That's what the tend and befriend response is doing for us. And for a lot of us, and really why some people, I think, are just sort of done with this, social distancing and done with wearing masks, is because there are such gaps in their positive social relationships, which may actually be elevating their levels of oxytocin, trying to get them to sort of affiliate, to bond, right? Particularly if people are living alone and trying to find an avenue for that. to create those social contacts to reduce stress, because at the level of the nervous system, it's highly, highly effective. And our system can actually turn that on for us, or we can aid it in turning it on, if that makes sense. So I'm gonna transition into thinking about ways that you can work with, again, in your day, to understand that this is the mechanism at play, and to think about how do you work with your own nervous system, how do you work with your own activation based on stress exposures. So the first is really about, the two things that are actually most helpful in terms of trauma stewardship are social support and presence. Our tendency to turn away from, tamp down, ignore the fact that we just experienced some kind of suffering and stress is really ultimately counterproductive. Works in the short term, not so great in the long term. So all of these are about cultivating presence. So a sense of being aware, self-awareness, and checking in with yourself. And I would encourage you to think about finding something routine, some routine way to do that, of just checking in with your nervous system, basically, so that you recognize activation when it's there. Because when you can name it, when you can identify that activation as being there, that's leveraging your prefrontal cortex to help downregulate the nervous system. Threat is always detected at the level of the nervous system, but we can engage the thinking part of our brain, our prefrontal cortex, to help downregulate that instead of continuing to drive it up. So recognizing the activation and just name it. Oh, my heart's racing a little bit here. I'm clenching my fists. My shoulders are actually finding their way up to my ears. And then tap in and see, what am I telling myself? What is the internal monologue right now? And is there something that I can do to help regulate? So starting with that self-awareness. And this is just, you'll have these in your handout. So this is just a little indication of, when you do that check-in, if you're feeling really reactive, if you're feeling really tight in your thinking, like you don't have space for anything, like if one person asks you one more thing, you're just going to lose it, know that that's probably a state of hyperarousal inside you. If you're feeling, on the other hand, really contracted, really shut down, like not able to feel anything, even in the face of something that you feel like that should warrant some empathy, and you notice that you can't even go there, that's probably a state around activation as well. And so you'll know you're in that when you do your check-in. If these things are happening, you're in your sweet spot. You're at the sweet spot of that curve. All is well. If you check in with yourself and you're not, you're kind of in one of those other zones, then to be able to check in with your assumptions and then ask yourself, what do I most need right now? Here's a couple of other tips that you can leverage to regulate yourself and activate that tend and befriend response. Just taking actually one deep breath. I know it sounds very trivial and maybe overly simplistic, and maybe you're even tired of hearing people say, just breathe. There is a physiological reason for that, particularly on your exhale. Your inhale is innervated with your sympathetic nervous system. Well, all of your breath is actually, and your exhale as well. But your exhale through your vagus nerve activation is going to help downregulate that sympathetic nervous system activity. So just one really long exhale can begin the process of regulating and getting you into that optimal zone. And if you can do a couple of them, great. Any kind of meditation practice, and I know that can be a hard thing to bring into your day, but meditation outside of your workday, or even little micro practices in your workday, actually just build the pattern. Meditation is, it is that bicep curl at the gym. You don't do the bicep curl to be able to do you know, the greatest bicep curl ever. You do the bicep curl so that you can, you know, lift stuff and move stuff and open cans, whatever. Same with meditation. So you do a meditation practice, you build that skill a little bit, and you can really see, particularly present moment, where am I putting my attention? And that's really the key. Mindfulness is really about present moment awareness of what's out here and what's in here, what's inside. So when you build a little bit of a meditation practice, you can get really skilled at saying, oh, where am I placing my attention? Am I placing my attention on 3 patients ago? Am I placing my attention on what has to happen after I leave here today? Am I placing my attention on all these freaking notes I have to write? Or am I placing my attention right here, right now? Because this is the only thing that's actually here and real. And meditation can help you do that. If you don't want to do a meditation practice, just this skill of where am I focusing? Where am I putting my attention? Another micro practice is to elevate your why into your day. So not just, you know, this idea like out here esoterically, oh, my work is meaningful, but really actually labeling that for yourself. What is your why? Why do you do the work that you do in the place that you do it? You know, a sentence or 2, maybe even bullet pointed. Why are you doing this work at this point in your life, at this place? And to be able to infuse that into your day through some way. It could be, you know, it could be a sticky note somewhere. It could be on your phone. You know, this is reasons people get sort of tattoos on visual parts of their body. I'm not suggesting that necessarily, but sort of, right, it's this reminder of a why, to elevate your why into your day, to not just have it be this kind of overarching, oh, this work is meaningful. And that why can change. It may change through the years. Another tactic is a practice, a micro practice called Just Like Me. Because we can get really activated, particularly in healthcare, when we see people making choices that increase the risk for themselves, increase the risk for others, and thereby make our jobs more difficult. And this is a hard one, we'll say, but when we can look at people and drop down into our common humanity and see them as just like me, they want to be safe. Just like me, they want people they love to be safe. Their strategies are completely different, perhaps. And what's behind those strategies may be a completely different set of facts or even reality than what you may have at your disposal. But there is this commonality of people aren't wanting to be intentionally reckless and put people that they love and care about at risk. No parent is intentionally putting their kid at risk. Their strategies may be different, but just like me, they want to be safe. The poem that comes to mind for me around this is a very brief one by Miller Williams entitled Compassion. And he says, have compassion for everyone you meet. What seems like conceit, bad manners, or cynicism is always a sign of things no ears have heard, no eyes have seen. You do not know what wars are going on down there where the spirit meets the bone. And I routinely come back to that sentiment myself to say, right, I don't know that person's story. I'm only making judgments based on what I see. It doesn't mean that the judgment isn't there, but can I quickly drop down into a common humanity? And then this idea of tend and befriend, can we bring it to ourselves? In the absence of being able to get a hug, give a hug, you know, can we actually hug ourselves? Can we put our hand on our heart? Can we care for ourselves the way that we know our best friend would if we were suffering, and the way that we do for people who are suffering every day? Our bodies don't know the difference, really. And again, this is all happening at the level of the nervous system. So our bodies don't know the difference between, or a big difference between receiving it from someone else and receiving it from ourselves. So actually trust that you can tend and befriend yourself. Your hand on your heart is probably the most, the fastest and most universal way to downregulate that nervous system, because it's a message of safety. And when your nervous system perceives safety, remember, we're wired for safety and connection. When it perceives safety, it can send a message that it's like, okay, we can back off the cortisol for now. So I'll just end with an overall sentiment here around, you guys have been working tirelessly, and whether you are in a position as a worker bee or as a learner or as a leader, I think this is the general sentiment that we all want for ourselves and that we all want for one another. So I know we're butting up on time here. I don't know if we have any, Joan, do you want to kick us off just with when to consider additional resources? While she's doing that, if anybody has any questions, welcome to entertain them in the chat.
So Tina and I really felt like it was important to mention some of the things that people might be experiencing that might be red flags or might be something to consider. Additional resources, additional supports, and we just put them on this slide. Just thinking about, I think all of our work has been impacted over this last 10 months, and to think about, has it been moderately to severely impacted? That might be a sign that it's time to reach out for additional supports. If your sleep or eating or your hygiene has changed, that is probably a sign that something bigger is going on, and you might benefit from partnering with an additional support person to kind of think through how to get you back on track. Also, if other people are noticing or asking if you're okay, telling you look tired, or telling you, maybe you should take a day, or do you need to leave early, and you're like, no, I'm fine. They're seeing something that maybe you're not seeing. If you're not talking to the people that you typically reach out to, or you're avoiding their texts or calls, or you're finding yourself kind of apathetic to connection, I think that's a sign that maybe something additional support would be helpful. And I think we all have our go-to things that make us feel good in the moment, whether it's alcohol or food or sweets, sugar, gambling, or TV. Tina mentioned that she's watched a lot of different Netflix series. I think a lot of us have exhausted the quality shows on our streaming apps. And so I think it's just really important to mention that it's a time to be reaching out for additional support that can look, it can be in a lot of different forms, whether it's spiritual support or reaching out to your EAP, reaching out to a mental health practitioner, or a meetup group that's to support, if you're a new mom, or reaching retirement age, thinking about connecting with peers in different ways. And there are several ways to do that. So just wanting, and you can always contact us as well if you're not sure really where to start, or you want to have a free consultation to kind of talk through what's been going on. So that kind of just goes into what we offer. And I think this is not just this is not like a, hey, Tend Health. This is here are some things that we think are helpful. This is what we commit to. Our counseling and coaching really comes from a place of wanting to provide access and kind of a quick, streamlined way to connect with a clinician, and to be flexible to your schedule, and to meet you where you are through telehealth. So That is what we do. And then we also think that groups and group coaching and classes together, doing stuff with other people, there's just a lot of value in learning from our peers and connecting with people who are like-minded and are looking to learn more. So that's a little bit about us.
Thanks, Joan. I don't see any questions in the question. I think I'm looking in the right place.
Yeah, thanks, Joan, and thanks, Tina. So let's see. While we wait for our attendees to start writing the questions, let's go over really quick with the things that people have to remember. You will be receiving an email within an hour, and it talks about an email survey. So please complete that survey. After the same survey, you'll be able to claim your CME, CE, or attendance certificate. If you had trouble downloading the slides, send me an email and I'll send them to you. Our recording, this webinar is being recorded and it will be on our website within a week. Again, if you have any questions about these or any future events, please email me. And in order to get your CME, you need to enter into www.eeds.com. You can see it all here at the bottom. And the activity code, it's this one, 70NAVE. And it's going to be available for 1 week. So please write it down and claim your certificate and complete our survey within a week. We'll really, really appreciate it. So we have some questions now. Well, actually, we have a comment, a comment from participant that just left. He just said, nice job, I gotta run. So if anybody has any other questions later on, because or if you cannot find the chat box or the question box, feel free to send your questions to my email address and I'll make sure that Tina and Joan answer your questions. I think they'll be happy to do it. Another comment just arrived. She says you were really good. Another comment, thank you. This was very insightful. You did a wonderful job presenting. And so we're getting kudos and well-received webinar. A quick reminder, next week we're gonna be having You Are the Key to HPV Cancer Prevention webinar. Just keep an eye on your email. And on January 28th, we're gonna have the lab practice from this wonderful webinar. So you'll get a reminder on your email. And if you know anybody that would be interested, please send them the information, tell them to email me, and we'll be happy for them to join us in this series. Tina, Joan, thank you so much for joining us today. It's been wonderful having you, and thank you everybody for participating today and for being up so early. And you ladies have something to add? Everybody has received this webinar very, very warmly.
You know, we just look forward to working with people in the practice lab. So please join if you can. Let this marinate and bring all your questions, and we'll work together further.
Perfect.
Thanks for coming, everyone.
Thank you. So thanks to you all for participating today. You have now completed the webinar and you may disconnect. Have a great day.
Okay. Done. Mommy?